folks, welcome back to the reading room. We have another video in this segment about subtle feline cardiomegaly, but I wanted to take a look at what it might look like if it wasn't so subtle. So this is a cat that has some pretty significant cardiomegaly and is in congestive heart failure. Let's take a look at what this is showing us radiographically. So this is a patient that presented dyspneic. They are having trouble breathing. Radiographs are one of our next steps, and this is what we identified. One of the things to note is the size of the cardiac silhouette. It's tall, causing dorsal elevation of the trachea. Cats have a very slender, very thin cardiac silhouette, oftentimes only a couple intercostal spaces in width. This one's getting up to be almost 4 at its maximum diameter. So this is a pretty large cardiac silhouette. And then similarly, in this dorsoventral projection, we've got enlargement of the cardiac silhouette. It's rounded, and it's taking up a good portion of the thorax. Remember that this should only take up about a central third of it. This is taking up almost the entire width of the thorax. So this is pretty significant cardiomegaly. So what are some other features that tell us that this is cardiogenic pulmonary edema as opposed to anything else? Well, one thing is the size of the pulmonary vessels. If we look out in the caudal lung lobes, there's some enlargement of those vessels in our lateral projection. And if we kind of zoom in, what we can identify is that there is some enlargement of a combination of arteries and veins in this patient. So this is a pulmonary artery here. I'm going to highlight that for you. Pulmonary vein. Similarly, coming out here, an artery. And the vein's a little bit challenging because we've got our vena cava lying over top of this region here. This is our vena cava. But our vasculature is also enlarged. When it comes time to causes of this pulmonary pattern, we need to be prioritizing a cardiogenic cause because of the cardiovascular changes in this patient. So what is that pulmonary change that we're seeing? Well, it's a multifocal, unstructured interstitial to alveolar pattern. We've got this increased opacity cranially, as well as in the perihilar region that is partially obscuring vascular margins in most instances, and in some regions forms some small air bronchograms, like here in the right cranial lung lobe. So again, outlining that region, there's soft tissue here, and centrally, this tubular lucency, that's evidence of an alveolar pattern. There's edema within this region of the lung, and then all we're left with is that air-filled bronchus. So this is cardiogenic pulmonary edema in a cat, cardiomegaly, and this has been an example of that for you to compare to the other video in this session, which has a more subtle instance of feline cardiomegaly, and I hope this has been helpful.